Hello and welcome back to the Masters Swimming podcast, available on all podcast platforms. I am your host, Jo Malone. Just kidding. Hello, everyone, and welcome to the Masters Swimming podcast. It is me, Bethany Hogg. You may have heard me on a couple of previous episodes as a guest, but Jo has been so kind to kind of pass the podcast baton for a very, very special episode. And this episode is all to do with women's health and how it affects us in swimming. So just a little disclaimer, this is going to be split into multiple parts. We kind of had a talk about how important this topic is in swimming and just for women in general. And we thought that we could not possibly cover all of this in 1 hour or 1 45-minute conversation. So we're going to have a part on kind of premenopausal cycles and kind of things to do with contraceptives and things to do with like race day and training and how periods affect you on a general basis. And then what happens when your periods stop? And that's going to be part 2. And I think that's going to be a really, really good episode as well. Just because most of our master swimmers are 45, 50 and above. And I think it's going to be really amazing. Got some great guests. But just to introduce our current guests, I am joined by some fantastic, fantastic ladies. So first we have Dr. Catherine Munro. So she trained in medicine in her 30s. She was working at Southampton University Hospital, and she also trained in menopause care, and she worked in a specialist clinic under Mr. Tim Hillard in Poole. When she retired from all of this, she was still really, really interested in aging and menopause and everything like that. And I think, am I right to say that you like volunteer at a menopause clinic now?
So no, I've just help out with a few friends and so on. So
okay, yeah. But Kathy is also an amazing swimmer. So she was really good. So I think you've ranked 5th in GB at some point, which is absolutely amazing. You went back to swimming as a master as a stress reliever, which is great. You've recently done some open water swimming and longer distance swimming, and you've competed at the Ice Worlds. Like, that's amazing. That's like actually incredible. And you're also training for the World Masters Championships in Japan, which I think our next guest is also training for. So I am joined by Rebecca Lennon. She is a palliative care consultant and medical director of community services at Bolton. She was a swimmer at national level, and then she was Masters national champion just before having 2 beautiful children, amazing children, very cute. And she's had some fantastic open water and long distance achievements since I've known her. So for the last, I would say, 18 months that I've known her, she did a 1500 at Aberdeen while having no sleep because her flight was cancelled. She did the European Championships open water with a broken foot and torn ankle ligaments. She is literally a rock. It is amazing. So amazing to have her on. And last but not least, we have, sorry, this is going on forever. Last but not least, I have Liz Ogbonmwan, professionally known still as Liz Kilcourse, and she is a sports medicine doctor and GP from Manchester, and she's mostly interested in female athlete health, endurance sport and public health. She was a swimmer when she was younger and then switched to running, and now she is a triathlete, and she's actually a very, very good triathlete. So she won the British age group championships last year, and she's now competing internationally in her age group. So welcome, ladies. What a star-studded roster to be so American. This is absolutely incredible. And I just think we've got such a broad spectrum of doctors. So yeah, welcome. So Kathy, you're with us for 2 episodes. Are you excited?
Yeah, no, very, very excited. So yeah. I think I might learn some stuff today as well. So.
Yeah, and then Becky, really excited to hear about kind of your experience with women's health and swimming as well. So welcome to the podcast as well.
You're very welcome. I'm probably the doctor with the least amount of expertise in women's health, but just bringing my personal experiences with obviously the medical knowledge behind all of that. Yeah.
Yeah, and I think also having Liz is going to be great because there are other sports that exist bar swimming. I know that's really difficult to believe, but you can kind of give us
part of the sport though. It's part of the sport.
But yeah, swimming is also obviously most important. But yeah, so you can kind of give your kind of take on how your health is kind of been affected by doing not just swimming and maybe running and cycling, which are also like really high intensity sports, and how that is changed. So yeah, let's, after all of that waffling from me, I'm just really, it's excited nerves. Like obviously we've touched on why women's health is so important. So basically I wanted to start with, I did a little survey and we got loads of really, really good responses, and I'm going to go over a lot of that today and kind of like give you kind of a general summary of like the responses for all you listeners. But I first want to go back to basics. So Cathy, with all of your medical knowledge, kind of, can we just introduce kind of what the menstrual cycle is and kind of those stages and what women go through every 28 days ish, or not?
Yeah, I can do a little bit on that. The menstrual cycle is quite complicated when you're learning it as a medical student, because you have lots of different hormones that come and go, and day one of the cycle is your period, which I always used to think was slightly weird. So I don't know how much, whether you want me to really go through a fairly medical answer, which is what us doctors tend to do, but the pituitary gland in your brain is kind of like your central control mechanism, and that releases two hormones which affect the ovaries. One is called luteinizing hormone, and the other one's the follicular stimulating hormone, and we like to shorten everything, so LH and FSH. And these hormones affect the ovaries, which and the ovaries then create, or I shouldn't say create, because your eggs, you're actually born with all your eggs. Which is quite incredible, but they affect the eggs you have, and also and create hormones in the ovaries. So the initial phase, you have FSH affecting and creating a dominant follicle, which then is the one that actually releases the egg, and the cells around the egg also release estrogen, so that's affected by the FSH. The luteinizing hormone affects the follicle and encourages some other cells around the ovary to release testosterone, of which a chunk gets converted to estrogen. So see, there's a lot here. So we're just kind of looking at the first couple of weeks. The follicle grows. You get a gradual rise in estrogen and testosterone, and then they peak, and you have ovulation. So the egg gets released, and then it travels on its journey, ready to see whether it's going to get fertilized. And in fact, I actually looked it up because needed a bit of revision. It was a while ago. I was a medical student, and the dominant follicle grows from 5 millimeters to 20 millimeters. So it actually does, wow, it becomes quite big. So when you have ovulation, the follicle it comes from collapses, and the cells around it release progesterone. And then this is called the luteal phase because it's linked with the luteinizing hormone. And progesterone is the hormone which I think can often affect things like mood, bloating, fluid retention, and I think some people are very, very sensitive to progesterone. And the progesterone role is to help get the womb lining, the endometrium, ready for implantation. And if that doesn't happen, the womb lining gets shed, and that's your period. And that's the cycle. And so it takes about 28 days, and it just changes over time, changes if you've got things like polycystic ovarian syndrome, and changes as you get older. And can be very, very variable. So, and guys, join in if I've said anything you don't agree with. Or...
I'm just sitting here going, I'm glad Cathy explained that.
I was thinking the same thing as well. I was like, that's such a tough opening question. Like,
I'm so sorry.
The menstrual cycle.
It's like I've written an exam
I think you did a really good job. It is. I was making notes.
I'm so sorry. It's like I've written like an exam paper for you, Cathy. I'm so sorry. I just thought like this has got to be like common knowledge, which obviously it is, but I think you've explained it in such a nice way, especially to do with like the hormones and everything. And so so obviously the luteal phase is kind of when you start to get, is that when you start to get sort of your like classic like PMS, premenstrual syndrome?
That's exactly when. So yes.
Yeah, and that's to do with the progesterone.
Yes.
Right.
And things all, they come and go at different phases. There isn't a nice diagram that all of the medical textbooks will show you, but
yeah. And so maybe a little more of a simpler question, and maybe a shorter exam question would be like, Becky, do you just want to like quickly summarize like what a period is and just what happens in your period, just very generally? I'm sorry.
No, I mean, I think periods are very variable from person to person. So your experience of your period is your experience, isn't it? And no one can take that away from you. Yeah. And I think, there'll always be variances of the normal and the extremes as well. So you will bleed for somewhere between sort of 5 to 7 days is sort of what medically is classified as normal. Mm-hmm. And how heavy it is really, really hard to quantify.
Yeah.
And I think, you don't go and measure it, do you? And I think, but it's probably not loads, is it? Can Cathy or Liz help me out? I think it always seems more than it actually is, isn't it, in reality? But
textbook amount is 30 to 80 mils, but I think you're exactly right, Becky. Like that can vary so much from person to person. So like one person it might be 20, another person may have a lot more than that. And I know that's something, Becky, that you have kind of like maybe we'll speak about later. But yeah, there's definitely that would be the textbook is 30 to 80.
And can that amount also, like for each individual person, can that just change due to kind of certain kind of lifestyle, environmental factors as well? Because I think a lot of people find, or a lot of like people that answered the survey said that their periods were quite heavy when they first started, and then they kind of, eased out and became more regular and a bit lighter. So I'm just wondering, like, what sort of factors can maybe determine whether you have a lighter or a heavier period, Liz?
So I think classically when your periods first start, so you first because of puberty and because of hormonal changes, it's almost the body adapting to that. So because of the fluctuation in estrogen levels as your body is your body doesn't switch from having no cycle to a cycle in the same way that when you get to the menopause, you don't switch from having a cycle to having no cycle. So I think it's to do with the hormonal fluctuations that happen throughout puberty. Often for teenagers, they may find that their periods are very heavy, and then they sort of settle down late teens, early 20s. And then quite often as well, towards the end of the menstrual cycle, from sort of 40 years onwards, women might find that their cycles start to become heavier again, or they can become closer together, or they can become longer. So I think that change in period cycles in that sense is to do with changing hormonal levels. The other thing that can have an impact on it, of course, is energy availability. So I don't know if that's something that you're going to ask questions about as well, maybe like later on. But for example, if you're not, particularly for someone who's a swimmer in an endurance sport, if you're perhaps not getting as much energy as you need, so enough food to fuel the training that you're doing, you might find that your periods are lighter because, again, that hormonal cycle that Cathy really beautifully described earlier might not be happening in quite the same way. So your body is sort of protecting its reserves in a way, and not bleeding as much because of that.
Yeah, and I also do you find that like sometimes your periods change if you're under like high stress?
Yeah, definitely. Yeah. And I think they showed some quite good evidence around that when it came to COVID, and just one example, but like after COVID immunizations, there's now like good research to show that women's periods changed after they had a COVID immunization. And I think part of that is stress, but that's just one example. Like it can affect you in so many ways.
Yeah, and I guess, yeah, when you have the immunization, it's like a foreign body as well. So your body is kind of like working overtime to deal with that. And then that's got to put you kind of offset you from where you kind of usually are. It's so interesting. I just think like menstrual cycles and periods, like it can be a bane for a lot of us, but it's like amazing. And like we can grow a human like that. That fascinates me. It's absolutely incredible. Like, it's just makes you feel like really special, even though we're like, there's a lot of women. You're just like, oh, really special.
And we still don't know everything. I mean, you're born with something like 5,000 eggs, I think it is. But you only obviously use some of them, and the body, we don't know how it selects which eggs look okay and things for you, and things we just don't understand any of those mechanisms. It's absolutely incredible. The only thing I was going to say is insulin affects the ovaries as well, and can amplify luteinizing hormones effects, and also encourage more testosterone to occur. So that's so particularly with something like polycystic ovarian syndrome, that's one of the reasons why you can end up with a bit more hair growth and a bit more acne and things like that. And and obviously insulin's associated with weight and diabetes and type 2 and so on as well.
Huge domino effect.
Yeah.
And so this kind of brings us quite nicely on to when we say about the kind of luteal phases, and when we have our period as well, we get a lot of side effects. So I'll start. I used to get absolutely horrendous period pain, and it did used to stop me training as well. I used to just get really horrid cramps, and it almost felt like my thighs were burning because it like stretched the whole way. So you get cramps, you get bloated. We have so many people kind of wrote in with just really, really horrible cramps. And obviously that's the uterus contracting to shed the lining of the womb. So, and it's kind of felt like for all of you that don't experience period cramps out there, it's kind of, I feel like it's like a knot being tied in my stomach and being pulled like really, really tight. And sometimes paracetamol does not work. I wonder if like any of you have had any like shared experiences of this, or what other side effects do you get? I think I'm quite lucky with just period pain, but I know people get a whole lot more.
I know Becky's got a lot to say on this because we spoke on the phone the other day, so I'll like let her speak a lot as well. But like I have very vivid memories of being a teenager and being on poolside and like just having really bad period pain, leaking through my swimsuit and being absolutely mortified that I'd leaked through my swimsuit. I don't know if that's ever happened to anybody else.
Yeah.
I think I fainted once at a swimming competition. My mum can probably like remind me if that happened, but I'm pretty sure I fainted at a swimming competition. So yeah, like I used to get like really worried around training when it was my period because you just were kind of stressed about pain and bleeding and all of that kind of stuff. Much better now, but when I was a teenager I used to find it really, really tricky.
Yeah, daunting as well. So yeah, Becky, do you have anything to add?
I think it's really hard because my periods would never be sort of classified as normal because I have an underlying condition called endometriosis. So I kind of not necessarily period pains, but pelvic pain. And also when my endometriosis was at its worst, I would get tenesmus, which is a medical term, obviously, but describes pain, spasmodic like pain, up your back passage. So it would feel like someone had a red hot poker jabbing right up my bum hole. And sorry I can't describe it in any other way. And so I would not be able to sit down.
But then someone out there, I'm sure, will listen to this and be like, oh my gosh, that's me. And it's like, you are not alone, which is like really good. That's terrible. I'm very sorry to hear that.
And I do, and with my job and being a palliative care consultant, I look after cancer patients with tenesmus, and I have a lot of empathy and sympathy for them. It really truly is horrible, and I have patients who can't sit down at all, and at least mine was cyclical but very debilitating. I did end up in this was before I even knew I had endometriosis, but I guess that led me to, I ended up in the emergency department one night, 2-3 o'clock in the morning, because I just could not sleep. I couldn't settle. I'd taken everything that I could possibly take, and I thought, well, this is ridiculous. This is just my period. Why? I can't be going to ED. But I was just so restless. Took myself there, and there was a really lovely, caring and compassionate ED registrar who, you know, just sat and talked to me. And I said, look, I know this is ridiculous. I know it's just my period, but I am in so much pain. I think she could see how much pain I was in. And it was her who said, look, you might need to think about whether you've got endometriosis. And I was at med school at this point, you know, and I don't know if I'd done my obs and gynae bit. I can't remember now, but I was like, well, actually, that's probably not a terrible suggestion. And off I went, sort of after symptoms had settled down, to see my GP, who just happened to be an ex-gynecologist. So match made in heaven. And it sort of stemmed from there. And that's when I got my diagnosis. But I probably had symptoms for quite a number of years by that point. My periods were incredibly heavy. As a teenager at high school, I remember one day having to go home from high school because I'd gone through all my sanitary products and all my friends' sanitary products in the space of a couple of hours. And so I was like, well, I've got no other choice but to just leg it home. So that's what I did. Ended up at the GP practice because my dad came home and he was like, what, you know, just found me basically hiding in the bathroom. And I think that was sort of possibly the start of it. And I was given some hormones called northisterone to try and stop the bleeding. And then I sort of got given tranexamic acid and mefenamic acid to try and help with symptoms, and tranexamic acid sort of stems bleeding. And I guess that helped for a little bit. It wasn't like a miracle. And then it just got worse from there. That was probably at my worst when I was at uni.
Do you think as well, Becky, when you describe that, because for me, it's you've had a really difficult experience, but you've also been so lucky with the healthcare that you've had in some, like in terms of that A&E registrar and then the GP, because I think there can be such a varied experience. Because if you haven't, perhaps if you'd had an A&E registrar who was having a bad day and didn't kind of pick up on, maybe I need to think outside the box on this a little bit, or if your GP hadn't had an interest in gynecology previously and probably still did, it could have made things very different for you. I think often when you speak to women with endometriosis, it can be quite a journey to get there. They don't just get a diagnosis straight away.
Is it an average of 8 years it takes to get diagnosed with endometriosis?
Yeah, and it's actually really common. So common in
1 in 10?
1 in 10 people. So that's 10% of females. And in medical terms, over 10% is common. That's what we would classify as common, isn't it? So
yeah, it is a common side effect on a medicine packet. It's like 1 in 10 is like really common, right?
Yeah. You see, I hear you describe your period pains and think, not sure they're completely normal, you know, and especially that leg, you know, the radiation in your legs is very endometriosis like.
Okay. Oh, that is.
We just diagnosed Beth over the podcast.
That's a lot of food for thought, actually. Yeah, so that's really good.
And I think you're right about the reception, because I think, you know, most women have periods. They're considered normal, and I think you can be dismissed of, well, this is just normal, and you know, just deal with it. So
we only have our own perception of pain as well, don't we? So we only know what we've experienced, so we don't know what another person's perception of pain is like.
Yeah.
No, and I think I'm so aware of that in terms of my own experience and also my clinical experience, because I have quite a lot of my patients have cancer, and some of them can have very small amounts of disease, but it can cause sort of overwhelming symptoms. And then people can have loads of disease with very little symptoms. And, you know, in terms of my endometriosis, when they actually went in and had a look with a camera, it was sort of sat behind my uterus and in front of my rectum, which is the lower part of your bowel. So it made total sense why I was getting pain where I was. But there wasn't very much. And it was, I remember being sat after surgery with the gynecologist, and she went, "We haven't got very much." And it's like, yeah, but the pain is horrendous. And because pain is a very subjective sensation. And that's why I said at the beginning, your period is your period, it is your experience. No one can take that away from you. And how you experience pain is an incredibly complex sensation. It involves, you know, your peripheral nervous system, your central nervous system, loads of neurotransmitters. So something that complicated is never going to be experienced the same way, is it?
No. And we see that in lots of things, don't we? Like we see it like in MSK related pain, back pain. So yeah, I think it's the same for period pain and menstrual cycles. And you know, that those small deposits of endometriosis that you had, were they sat on a nerve? Were they just irritating your back passage? So you could have had loads of deposits somewhere else that weren't doing anything. So it's that kind of has a role as well, doesn't it? So yeah, there's so much about it we don't understand, I think.
Yeah, like still, like there's, you know, half the world's population go through this, and there's so much that we don't understand, and everyone's description of their pain is different as well, I guess.
Well, at the moment, one of the things that I'm doing is I'm working with the English Institute of Sport, and we're looking at their female athlete health guidelines. So I'm kind of like putting them together for them in terms of managing things like PMS and heavy periods, and even things like breast health and pelvic floor dysfunction, stuff like that. And there is so little research. Menopause is another one as well, Kathy, although I wouldn't, I'm sure you'll know a lot more about that than me. But yeah, like there's just, you can do a PubMed search and you find like one page of results. There's hardly anything at all in terms of research that we've done. I think it's only been the last few years that this has really started to be spoken about. So I think it's really good that we are speaking about it more, rather than it being sort of a taboo subject that's not discussed.
Definitely. So just moving on, obviously I did a survey, and one of the questions was, has your period ever affected your ability to train as a swimmer or an athlete? And over 75% of the responses were yes. And most people have also been affected on race day. So the most common answers were kind of sometimes and regularly, which I guess is right, because it falls, obviously race day, it doesn't fall regularly, but periods sort of do. And you can't like really time, you don't know when they're going to like coincide, but it's just like over 75% of responses were like, yeah, I was affected by this, or I am affected by this. And I'm just looking at the responses, and there is just such a varied response, and like so many different symptoms and PMS symptoms. Like most of it was just loads of pain. It's actually quite hard to read these, but really like really heavy and painful periods, mood swings, tiredness. We had irregular cycles that became regular and irregular through years, just a lot of pain which has been kind of a lot of pain which was trying to be like treated by contraceptives and contraceptive methods. What else? And yeah, like depression and anxiety just before your period as well. So it just really like a huge physical toll and a mental toll on like so many women. I was just wondering, like, so getting on to kind of the whole women in swimming, what do you think, what are your like best kind of tips, or how did you cope with swimming and having kind of period pain, Cathy?
So my best tips. Well, I mean, I think I personally had it relatively easy, in that I had a bit of pain and fairly regular cycle. I think it was a long time ago that I had periods with swimming, because I also ended up on a Mirena coil and then had no periods for quite a long time, got pregnant without having a period, things as well. So, and then I assume at some point went through the menopause. I mean, obviously, the oral contraceptive pill is something that you can take, and I think it's really fascinating about the gap to make sure that you have a bleed, and we actually know that that's not something you actually have to do. You can take them continuously, but I'm not sure about the research of what the risks are of being on the pill continuously for a very long time from quite a young age, and I don't know how much research there is, and I don't know whether anyone else can answer that question. But yeah, I'm pretty certain when I had a bit of a tough time, my dad, who was a GP, arranged for me to take the pill, but I'm sure he told me that it wasn't a form of contraception. I think
that's such great dad advice.
So but I can't remember, discussions over what sanitary products you should wear and all that, but mine were relatively light when I was younger. So I kind of got away with some relatively simple pain relief, but it's really hard, and it's so incredibly variable. Anyway, I don't know what you guys think about oral contraceptive pill and swimming.
Well, I guess it's really varied with oral contraceptive, isn't it? Because there's so a lot of the world that I work in, or I'm doing more work in, is around with endurance sport and athletes. So there's almost a bit of a step away from wanting to, not a step away, because obviously contraception is really, really helpful for doing just that, contraception, preventing pregnancy, which certainly for younger swimmers, so those in their late teens and 20s, will probably be wanting to avoid, or I assume would be wanting to avoid. But I think some of the evidence is showing that long-term, certainly progesterone-only pill can have an impact on bone density, which can sometimes be a problem for endurance athletes. And there are certain combined contraceptive pills which are better than others when it comes to managing premenstrual symptoms, which is what you were describing there, Beth, that people have sent in on their survey. And those are super individual. So in terms of advice for people who are experiencing those symptoms, I think that there are so a lot of those symptoms people describing are PMS symptoms. So there are simple things that you can be doing to manage PMS symptoms. So making sure you're getting a good diet around your period. There are tracking your period. So there are apps now like Fitter Women, which can give information. So you can you can track your symptoms and then get a bit of an idea yourself about what symptoms you may get on what days. And so
there's even cycle tracking on Apple and Garmin and anything watch or smart device, and which is I find the Garmin one has got a range of symptoms, so it's quite good to kind of learn about yourself.
And the good thing that some of them have as well is advice on, there's no good evidence for it, but they've got advice on so for example, vitamin B6, there's some low quality evidence to suggest that taking that in the run up to your period can help with symptoms. So they have recipes which include those vitamins, so or food which include those vitamins, which it may or may not have an impact for you, but it's certainly worth trying. And then there are other simple things that you can try, just pain relief, hot water bottles, things like that. I think if you get into a point where you're getting symptoms which are real extreme anxiety or depression, not even really extreme, but anxiety or depression that's affecting your day-to-day life, it may well be worth making an appointment with a doctor to discuss that, because that's probably not a normal thing to be experiencing before your period. And if you are experiencing really bad PMS, and there are things like certain combined contraceptives which can help with that, some of which are better than others, but also even trying a low dose of an antidepressant just for the week before your periods, which can really help. So you don't necessarily have to be on it for the whole month, but you can be on it for just 1 week. So those are the options which it might be worth knowing you can consider. And then if you're really struggling just on those just with those things and you're not finding that those are helping you, then you can always be referred on to a gynecologist who can have more of a chat with you about other kind of hormonal methods to try and manage period symptoms. So just first of all to say that, so people don't have to think they have to really be struggling, but obviously there's going to be such a variety within what you're saying. And then on the taking the pills back to back, so yeah, I think a lot of the guidance now is around taking 3 pill packs back to back, or certainly if you think that a period is going to fall in a major competition, then you could run 3 pill packs back to back so that you're not having a bleed in that time. There are other contraceptive methods like the Mirena coil that you mentioned, where you don't have a period with the Mirena coil, so that is another way that you might help to prevent symptoms as well. The other thing to be aware of is, and this is probably again more relevant for athletes who perhaps have had problems with eating in the past and perhaps are underfueling, is that any bleed that you get on the combined pill is not a period, because the combined pill that you're taking is actually masking the natural menstrual cycle. So it's a withdrawal bleed, it's not a period, which is just important to be aware of, because if you're considering fertility and things in the future, and if you had like problems with underfueling in the past, it's not a true period that you're having there.
Yeah, wow. That's so much. That's amazing. That's like some great information. And yeah, I guess overtraining can also be a factor with your periods, because if you overtrain and put your body under so much stress, or if you lose a lot of weight, your periods stop. They can stop, can't they? Because your body, like, you don't have like enough energy to like carry a baby, grow a baby, is that right?
Yeah.
I'm trying to like reach into the depths of my mind at everything I know about myself and like women's health.
No, that's right. So it's a condition called RED-S, which stands for relative energy deficiency in sport. So essentially, like, it used to be called the female athlete triad. And so, but the name changed in about 2014, and that was to recognize that men can be affected too. And also that there was more of a broad spectrum of symptoms. It wasn't just no periods and osteoporosis, so thin bones, which is what it used to be thought about as. We now know it affects like psychology, gastrointestinal, even your like endocrine function, immune function. It affects a whole broad range of systems, psychology as well. But that's on a spectrum too. So there's the very kind of extreme end, which is when you would get amenorrhea, which is no periods, through to having irregular periods, which is oligomenorrhea. And then you can even be having a regular period but not ovulating with it, which is called an anovulatory period. So yeah, there's a broad range of spectrum there, but we certainly know increasingly just how important that is. And I think for all women, if you're doing a lot of sport, it's really important to be aware of if you're having a regular cycle, because it's a really good marker of health. And if you're not having a regular cycle, if your cycles are becoming less regular or lighter, that's just something to be like, to recognize in yourself and think, hang on a second, what's my fueling like? What's my stress like? What's my recovery like?
Yeah.
Liz, can I ask?
Yeah.
So if you're a woman listening to this, and what we're saying is, look, if you have any symptoms that are impacting on your sport, your training, your life significantly, you need to go and see your GP. But to me, they need to go and see someone like you. Because
yeah,
I don't think every GP necessarily has that sort of knowledge. So how can people find out who the GPs with a special interest in sports medicine are?
That's a really good question, because I don't think there's enough. Number one, there's not that many others, and number two, I don't think there's really a good service set up in place. So like, we're always trying to push to have more sports medicine in the NHS, but like, that's a like real battle to have with commissioners. So it's really difficult, because I guess the best thing you can do as an individual is probably like go with information to the GP, and if you get an empathetic GP, or who understands, they should probably be able to refer you to gynecology, who should have an understanding of some of this. Trying to think if I can give a better answer than that, because I think services can be really variable. Certainly in the private sector, there are definitely consultants in sports medicine and gynecology that are really interested in this, and I know of clinics down around London and even being set up in the northwest around this. But in the NHS, I think it can be a little bit more tricky. Sorry, that's not the best answer, is it?
Yeah, I agree. I think it is super variable. And the only other thing to add in on everything that you said was that you can go through the menopause at any age. So if you're not having periods, if you've never had periods, or if they stop, you sometimes need some other investigations as well. So I don't think people realise it. People can go through. I mean, when I was working in Poole, I know there are people that came to clinic that had menopause at 14 and things. So it's not common. But
I didn't know that was possible.
But yes, there are all sorts of different reasons. But if your periods aren't happening, it's really important. And on a personal note, outside of swimming, I learned to row and did lightweight rowing and went through a phase of having no periods, which I thought was fantastic because they just didn't interfere with training at all. And then when I did medicine, I was like, that really wasn't a very, very good thing. So osteoporosis affects you significantly much later on in life, although we have had runners with stress fractures at quite a young age, and bone health and things like that are really, really important. So and periods are a marker of good health.
It's definitely so if you're not having periods if you're amenorrheic, that means having no periods for 6 months or longer, you're at risk of osteoporosis whatever your age. So it is something to really, really be aware of as any endurance athletes. I think as swimmers it probably gets picked up less because you're not a weight bearing sport. So in something like running or triathlon, you're doing running, so if you're going to get a stress fracture, it's going to get picked up. But if you're not having periods, or you're picking up illnesses all the time, or you've got injuries that are not getting better, then that's something to just really be aware of. Because I think in the past, it was just seen as normal if a female was training a lot and didn't have a period, but it's definitely not normal.
Wow. This is this conversation just gets better and better. I think we're just covering so many bases here.
Can I add one other thing? If you go the other extreme and have loads of heavy periods, the other thing you can be is anemic. And in the emergency department, I remember having 1 or 2 patients in who were it was amazing how low they'd got, because it happened very slowly. Their body adjusted, and then it kind of gets to a tipping point, and then fainting and whatever. And quite often, if you're on a diet where you restrict certain things, particularly if you're following a very strict vegan diet and you're not taking supplements and things, that it can be a real issue. And obviously, and being anemic and trying to compete, you're just not going to be able to do your best.
We actually had when I was asking when I did the survey, and it was if you feel comfortable, can you give details of kind of how your period was affecting your training? A lot of answers, actually more answers than I thought, were I would faint when the set was really hard and I would be anemic because of the blood loss. And it's really hard. And it's how do you make sure, obviously if you're anemic, we're always told to eat foods rich in iron, take an iron supplement, but just trying to kind of work that into your day. It's just so many more things to think about, nutritionally. So I was gonna, sorry, Lizzie, did you want to?
No, I was gonna say you can supplement with iron. So there's different types of iron supplementation you can take. Some of them can really irritate your stomach, so you can almost create another problem. So particularly ferrous sulfate can really irritate the stomach. There has been some evidence that suggests that if you take an iron supplementation on alternate days, it's as effective as taking it every single day. So you kind of get the same benefit in terms of improving your hemoglobin, which is your red blood cell count, which is what goes down if you're low in iron, without getting the GI side effects and the tummy side effects in quite the same way. So that can be something to try. So again, that's definitely another one that if you're struggling and feeling very tired around your periods, then see GP, because it might be worth getting a full blood count and checking your ferritin and folate as well, and iron stores, because sometimes your hemoglobin can still be normal but your stores can be low. And if you're trying to push your body like you are as a swimmer, then quite often your hemoglobin might be normal or the lower end of normal, but you might have lower stores, but you're more sensitive to it because you're pushing yourself more than other people are.
Great. So moving on, and this is going to be Cathy and Becky's kind of time. Pregnancy and having children and training and swimming and doing things while pregnant, after pregnancy. So I have heard that you have some lovely children between both of you respectively. I can't even say anything right, but so did you both train kind of through pregnancy? Did you keep your fitness up, or did you have a lot of kind of pregnancy symptoms? Is it symptoms? I've obviously never had a baby, so
I've had 3, and swimming was just so brilliant when pregnant. Because it was the one thing that you could get in and do and actually feel relatively normal. Tumble turns.
I imagine that's quite hard.
I think swimming felt good, especially in the later stages of pregnancy, because you just feel so heavy. You've got this baby up in your diaphragm, foot under your ribs, and you can never get sort of comfortable in a sitting position, but get in the pool and you're just kind of you're weightless, aren't you, and you just float, and it sort of takes all those issues away, and that's why I think swimming in pregnancy felt really good. I pushed the tumble turns for as long as I could, and I kept asking people, when do I stop? No one could really tell you, and so you just stop when you can't physically turn over anymore.
Yeah.
You've run out of space.
And in terms of training, did you just kind of listen to your body, or did you get kind of a second opinion with someone, or were you just kind of like listening to yourself?
There is some guidance on the Royal College of Obstetrics and Gynecologists website, which is helpful. There is not lots of evidence out there, but essentially if you have done strenuous activity pre-pregnancy, you're okay to continue, but the advice is you don't start strenuous activity if you weren't kind of very active before. So I think it is all about listening to your body. I think there was a school of thought about not getting your heart rate up above a certain level, but I'm not sure that's I couldn't find that on the RCOG website this time round. So I think it is all about how hard you can push it, and what you feel like. I think you just start to get incredibly breathless towards the end because your lung capacity is not quite there.
Yeah.
You've got something, your lungs are pushing down onto a solid mass inside your tummy, so you just naturally get slower. But that was really psychologically hard.
Yeah.
So
do you feel like you'd almost lost fitness, but you hadn't lost fitness?
Yeah. And so when I got pregnant, I'd stay in the same lane and going off the same turnarounds, and then you just kind of slowly, as you get through pregnancy, can't do that anymore, and then maybe you'd have to shift lane. But that's quite a psychological shift. I'm like, I'm going down a lane, oh no. But you think all for the greater good. It's a temporary thing, isn't it? And it is important to stay fit whilst pregnant, because labour is a marathon.
Yes,
so
I can imagine.
And my first labour was over 24 hours in active labour as well. So I was pretty knackered afterwards. But I remember thinking, well, what if I wasn't that fit? How would I have fared? So it is important to stay fit. So keep swimming. And out of all the sports, you're not going to bump baby. It's not a contact sport, is it? So it's actually the one that you can probably keep going fairly easily during pregnancy too.
Yeah, I was going to ask Liz if obviously you do like multiple sports, and obviously I know that you currently have no babies, but do you are you kind of, can like women do a lot of running and cycling? Because this may be a stupid question, but like I've never known like anything other than swimming, and I know that like swimming it's probably okay, but obviously running is really like hard impact like into the ground, like gravitationally. So
I think it's super variable and it's super individual, like Becky was saying. I think like you described it, like perfectly, really. Like, so if you're already active, keeping active during pregnancy is completely fine. So that, they say don't introduce strenuous exercise if you haven't done it previously, but if you're already swimming, running or cycling, then it's safe to keep doing so during pregnancy, as long as there are a few risk factors for it. So, you know, there are a few things which would make you high risk, and then they would suggest that you don't, but those are a few, those aren't the majority. So for the majority of pregnancies, it's okay to keep exercising. Like I say, I don't have children yet, but you know, from kind of both medical knowledge and from friends who have had children, it's just such an individual experience. So some people will find that they really struggle with hyperemesis, so they don't want to go out and run because they feel really sick. Other people, you know, have ran right up to the day before they've given birth because they've been fine and they've enjoyed it, and it's been it's something that makes them feel like them, because you're growing this baby, you're getting bigger, you've got all the worries and anxieties, particularly if it's the first pregnancy, of what may be to come. So it's a time to have for yourself, and I think that's really mentally important. And also, exactly like Becky said, labor is a marathon. It's a real stress on the body. So if you can go into that process fitter, then you stand you have a reduced chance of having like adverse outcomes from that. There's so many factors that can affect how labor is going to go, but you're certainly giving yourself a better chance of having a positive outcome from labor if you go into it fit, and from recovering on the other side as well. So we know if women are active through pregnancy, they're more likely to be active after pregnancy, and they're less likely to have postnatal depression as well. And the same with the heart rate thing. I think they used to say it was a max of like 140 used to be, but now they've said 90% of your max heart rates. I think no one's been brave enough to do studies doing anything more because of the risk of reducing blood supply to the fetus. So any kind of more than that, it's on a very like individual basis. So I certainly wouldn't be recommending people that do that. But yeah, I think running and cycling is just very individual, and it's very much on how you feel. So if you feel comfortable running, run. But if you don't, listen to your body, because your body always knows best. And I think it's the same with cycling. For people that I know who've cycled through pregnancy, a lot have just switched indoors just because of the risk of being outdoors. And also you might need to change position. So, if as your bum gets bigger, you probably need to be more upright. And then saddle pressure as well can have an impact. So, but yeah, most people, if they've cycled through pregnancy, they've just switched to the turbo.
Yeah. Oh, good. Great. So obviously you've mentioned kind of post-birth. How did you get back into swimming after you had children, Becky? What was your kind of road back to regular distance training?
I ended up with a cesarean section with my first son after 24 hours in labour. So quite disappointing, and so that was more to do with him than it was to do with me.
I was also
that's why I was like, as I was saying that before, I was like, there's so many things that can happen in labour, so I don't want anyone to go away and feel guilty and feel like something hasn't worked out in their labour, because my experience of labour ward is that so many factors play into it. So
and I also was a sunroof baby, and my mum is a swimmer, and she was also very annoyed.
Yeah. Nothing wrong with being a sunroof baby.
She was like, get it out.
The most annoying thing and frustrating thing post cesarean section is not being able to drive. And so I could, it's actually, it's considered major abdominal surgery. So again, we normalize these things as women, but someone cut through my abdominal muscles and my uterus to get my baby. And when you put it like that, that is major abdominal surgery. But we completely normalize it as women. So no, you're not allowed to drive afterwards. You've got to be able to emergency brake, and because it's so low down, in your pelvis, and you use your core to do that, you're not supposed to. But I really pushed it because I recovered very well post-section, and I remember phoning the insurance company and going, I can do an emergency brake, so can I please drive? And because you're supposed to leave it sort of 4 to 6 weeks, aren't you? So at 4 weeks I started driving again. So at 4 weeks I got back in the pool, and I do remember our coach at the time, Nikki, because it wasn't Bob, going, are you really okay to be here? He was clearly very nervous about having someone 4 weeks post major abdominal surgery and postpartum in the pool. But I was like, I'm getting in, I'm here, I want to feel like me. Because I think, I lost a bit of identity when I had my son. I think as doctors, we're a lot of, I don't know, I'm speaking for myself here rather than Liz and Cassie, but certainly for me, a lot of my identity is coupled up with being a doctor. And so I've not been at work for 8 weeks. I sort of lost that identity. And then you take on this new identity of being a mother, and you have to try and find yourself. And how do you find yourself again? You get back in the pool, don't you, if you're a swimmer? So for me, that was really, really important. And I did listen to my body, and I didn't push it. I went really slow, just started off, but it was just so nice being back in the water again.
Yeah, definitely. And swimming,
I think that's the great thing, like with swimming, like a little bit like when you're pregnant, you can like keep going for a long time because it's not like you're in the water. Post baby, as long as the bleeding has stopped and the wound's healed, if you take things gently and listen to your body, from probably 6 weeks, and most people, Becky was probably worth pushing it a little bit, but like it's it's so varied. And obviously, like, you've been fine, haven't you? So you know your own body, like you can kind of start to get back in at that point.
Well, I do face things like swim 3Ks with broken feet and torn ankle ligaments. So, you know, I am made of sterner stuff.
Yeah, I'm seldom not a person with the resolve of Becky.
Yeah, and like guidance is just that, it's guidance, isn't it? We all know that, like it's there for a reason, but it's not always like, yeah.
And also major abdominal surgery. I've just realised that I've taken my poor mother for granted for 25 years. I'm sorry, Mom. Yeah. I appreciate it now.
Can I add in pelvic floor exercises?
Yeah.
Oh, you must do them. And I was listening to a pelvic floor physio, and the idea was, it was a huge number, like 90. You know, you kind of divide them up into sort of 10s and 20s, but you know, 80 to 90 a day would be a good number. So
and you should start them during,
whether we're all doing pelvic floor exercises now.
You should start them during the pregnancy as well, shouldn't you?
Yeah. But you must, you must carry on.
I just started doing them now.
When with my second birth, I ended up having a vaginal delivery. I don't want to say normal birth because it's not, you know, every birth is normal, isn't it? So it's a vaginal delivery. And Isabella, I got a 3rd-degree tear, so I ripped nearly right through to my rectum, and had to go to theatre afterwards. So I had 2 very, very different labours. And I had a friend who'd had something very similar and ended up with real incontinence issues because of not doing pelvic floor exercises. But so I was like, literally day 1 afterwards, got the Kegel trainer app, and I did them every day, multiple times a day. And I do remember at my 6-week postnatal check, which you have with one of the women's physios if you've had a 3rd-degree tear. I remember her going, right, come on then, sister, show me your pelvic floor exercises. And I do remember her going, oh, it moved. I was like, yes, I've been doing them religiously. And I think, you know, some of that comes from we're athletes, we're disciplined. And I guess I knew what the consequences were and it wasn't going to happen. And so I don't have incontinence issues now, thankfully. But definitely can't do some yoga positions without letting some gas out.
So don't go anywhere near you in a yoga class then, is that what you're saying, Becky?
What about when you're on the blocks? Should we stay away from you then, like about to dive as well?
All right, on the blocks, and you know, I don't take my dive seriously anyway, because what's the flipping point when you're swimming, you know, 1,500 meters? Taking half seconds. Yeah, exactly.
Or 10K, yeah. Yeah, fair enough.
Men have a pelvic floor too. And I was just about the gas issue. Yeah, my husband. So he can't hear. So.
I think we could complain for a long time probably about our partners. Yeah, like that's anyone out there. So And then the kind of last thing that I wanted to touch on, so it's been like a really, really insightful and great conversation. I hope it really empowers and makes a lot of women feel really comfortable about their own experiences with their own health. But the last thing I want to come on to is just other kind of gynecological issues that may make your menstrual cycle irregular, your periods irregular, and maybe also could affect like pregnancy or like other issues. So Becky, like what would you describe as kind of these gynecological issues? Like, I know you have endometriosis, but there are lots of other ones that I think endometriosis is a bit more talked about now, but I think there are other ones that are really not spoken about still, like, and it's still like
so I think Kathy talked about polycystic ovaries before, so that's one condition. People can get ovarian cysts, so if you have pain that's just on one side, think about, and especially pain, it doesn't necessarily be pain during ovulation, is it? It can just be constant pelvic pain. So where one of those follicles that's developed during your menstrual cycle doesn't then regress, can turn into a cyst. You can get what you call chocolate cysts with endometriosis. So you have that's where your endometrial lining ends up in your ovary, and so when the cyst grows, it's actually got blood in it. And it's really interesting if you ever see them lance them during surgery, because it looks like dairy milk chocolate having melted just come out, and that's why they call them chocolate cysts. So some people with endometriosis might not necessarily get period dysfunction, but might get pelvic pain associated with having a chocolate ovarian cyst. And there's other things like fibroids.
Yeah.
So fibroids are they're really just massive growths in your endometrial lining, isn't it? Can Kathy or Liz describe them any better medically?
Yeah, so they're benign. So benign means non-cancerous growths that sit within the lining of the uterus, so the endometrium or the myometrium, which is the muscle of the uterus, so they can sit in different layers. And a lot of us can have fibroids and never really be aware of them, and they're not really cause any problems. The time when they start to cause problems is if they grow quite big, and then they can start to, Kathy might know the hormonal reason why this happens, but they can cause very heavy periods essentially. So if you're somebody who is experiencing very heavy periods, then it's definitely that is something to be considered, and those can usually be picked up on an ultrasound scan.
Yeah, and obviously to everyone out there, like if you have kind of anything that aligns with what we've talked about, and it is really affecting you, like, again, I'm reiterating it, we've said it again, do go and see your GP and try and kind of really outline and see if you can get like a women's health specialist as well, and really like make that really clear and really advocate for yourself as well, because sometimes you may just get a doctor on an off day, or a doctor that kind of isn't really specialized. So yeah, so how can people with, I guess it's quite a hard question, but how can people with these kind of gynecological issues, and what are the like treatments, or kind of how can they kind of thrive with these issues instead of kind of just like survive them, I guess?
I guess there's such a broad range of things, and like we said right at the start, everyone is so individual. So I think the best thing that you can do first of all is get to know your body. So like using Garmin or Apple or any of the kind of tracker apps, and sort of get an idea of like what's going on. And I think if you're getting symptoms which are interfering with your quality of life or your ability to train or swim or anything like that, then I think that's sort of like at a point where you should probably be seeking advice. And sometimes it might just be that there are simple things that you can do to manage it, but sometimes it may be that there is something a little bit more going on. So I think knowing yourself is, I don't know if the others would agree with me, is really important. It's probably the first step. And then, you know, if you feel like anything we've said today has just made you think, oh, maybe that's not normal, then getting advice from there. I think you're right as well, Beth, just being an advocate for yourself is so important.
Yeah,
and don't be afraid to go and ask.
Yeah.
I agree. And I think, and some things can run in families. So, you know, if you know you've got mum, sister, grandparents, you know, have a chat with them. And sometimes what's normal in your family isn't normal, as in, things could be better. So yes, and I think, I think the world is changing, so I'm 60 now, and I look back on my life, I think things are a lot better, and GPs are amazing. They work so hard, they know so much, and if you've got a good one, they really will be able to help you.
The world's definitely changing. Like, I think, and Kathy, like these days at the moment, like I only do 1 day a week as a GP, but I probably see or speak to 4 or 5 women in that day about menopause. And I think that's kind of off the back of programs like Davina McCall, and just the increased awareness, and women of that age coming forward and saying that they're having problems and having HRT for that. So yeah,
I think if you have, because I think you can get any doctor on a bad day, can't you? And or one that's not quite as sympathetic to women's issues. Don't let that put you off continuing to seek help. That you're often part of a GP practice that has multiple GPs. There is absolutely nothing wrong with walking out of there and booking an appointment with a different GP on a different date.
Yeah, I think that's really good advice, because a lot of people feel like tied to kind of one GP, but it's right that every doctor has your medical history right in front of them, and they do look at it, and I think they use it to make informed decisions. That's why it's there. So yeah,
there may well be a doctor who's a swimming parent, who has a role in your club and things, that you can chat to informally, or you even get some pointers on where to go locally to you.
Yeah, that's a really good point.
Yeah. Okay, so that was absolutely incredible, and I think we've just about covered all of the things that I wanted to cover. It was amazing to just hear like your experiences and be able to share mine, and also I think it would be like great if people wanted, or listeners wanted to, we could also kind of start almost like a little group for kind of advice, and giving advice and sharing advice and asking questions about women's health, and just deriving that in master swimmers, because I just think sharing our experiences and talking to each other, and like I know that a lot of clubs are not Trafford Metro, in that we are a lot of very loud and very chatty ladies, and we will tell each other everything, but hopefully, like, if your club is quiet and there's not a lot of chatty women, then I think it could be good to make almost like a forum for women master swimmers and men master swimmers to learn about this as well. Like, I think that might be like a really good idea, and we can just kind of share and any tips and tricks and stuff like that. So I think this has been such an amazing like hour, and thank you so much to all 3 of you for coming on. Like, this was incredible. I feel very emotional. It's really lovely. We've touched a lot of things. So yeah, that is all for today. But we will be back with part 2. It will be solely about the menopause and everything related to it. There will be a new questionnaire, and it will be much more open-ended, because I feel like I have no experience, so I will just be facilitating the conversation, and we will see Kathy again, and I'm sure that we will have Becky and Liz back on, because they have been absolutely amazing, as has Kathy. So yeah, thank you so much, ladies. It has been an absolute pleasure, and I hope you all enjoy it. So thanks again, and see you again soon.
Cheers.
Bye.